is Shannon Petroske. I'm a nurse practitioner and I work in oncology and hematology. So we had a question, what is hematology? So I don't know if everybody knows, but oncology is working with cancer and hematology is blood. So cancers or disease of the blood. So I have about 18 years nursing experience, and most of that has been in oncology in some sort. I've worked inpatient and infusion therapy as an RN, and then went back to school to St. Scholastica to get my nurse practitioner. So I feel very honored to have the privilege to work with amazing cancer survivors every day. So who is a cancer survivor? This is anyone with a history of cancer from the time of diagnosis through the remainder of their life. Years back when we talked about who is a cancer survivor, what people thought was this is somebody that has outlived cancer, or they're someone that are years out from diagnosis and haven't had a recurrence. But when you think about it, the moment that you're diagnosed with cancer, you are surviving, and that makes you a survivor of cancer. These are some statistics on cancer survival. So in 1971, there were 3 million people that were living with cancer. Today, there are more than 15.5 million cancer survivors. And you can see about 67% of cancer survivors today were diagnosed 5 or more years ago. And nearly half of all cancer survivors are 70 years of age or older. Most cancer survivors were diagnosed with common cancers, and you can see, 23% with breast cancer, 21% prostate, colorectal, cervical, uterine, and ovarian, and then melanoma. So these are commonly diagnosed cancers, and we would then assume that most survivors were diagnosed with one of those. Another slide here showing in January of 2016, and these are divided male and female. In January of 2016, total male cancer survivors were over 7 million and female over 8 million. And so now projections, when we look at January of 2026, they project that there will be over 9 million male cancer survivors and over 10 million female cancer survivors in the United States. That's huge. And this is another graph just showing the incline of, here in 1971 and where we've gone up to now, over 15 million cancer survivors and over 20 million by 2026. So why do we have these increased survival rates? And we think, based on what we've seen in research, there are 3 major improvements that have happened. And one of them is some of the screening tests, mammography for breast cancer. And I just want to touch on this a little bit. We now have something called 3D mammography or tomosynthesis. I don't know if you've heard of that, but that really helps us detect cancers earlier, especially in women with very dense breast tissue. So that's new, and that is coming to Grand Itasca. And then we have the PSA. It's a blood test to help detect prostate cancer, colonoscopy, which helps us detect colorectal cancer, and then Pap test for cervical cancer. Another major improvement is that we have improved management of side effects. And why this is important is because when a patient is undergoing chemotherapy and they have side effects that delay their treatment, that gives more time for the tumor to grow. So if we can manage those side effects and keep that chemotherapy treatment on track, that helps survival rate. And then we have some new and improved treatments, such as targeted therapy and immunotherapy. And I don't know if anyone knows what these are, but targeted therapy I'm going to touch on. What this is it's medications that are specifically targeted to certain cells and molecules in the body. So with standard chemotherapy, what that does is it kills healthy and cancerous cells in the body. With targeted therapy, it focuses on just the cancer cells. So we're keeping our healthy cells from damage from chemotherapy. And then with immunotherapy, we are using drugs that make our own immune system attack the cancer. So these are some new and wonderful advancements. There are 3 different phases of cancer survivorship. With the acute phase, this begins at diagnosis and it goes through the end of the initial cancer treatment. And during this phase, we focus on the treatment itself. Extended survivorship begins at the end of cancer treatment and goes through the months after. And what we focus on here are the effects of cancer and treatment. And then there's permanent survivorship. And this is when years have passed and recurrence seems less likely. And what we focus on here are the long-term effects of cancer and the treatment. So I want to just touch base on different phases. Like I said, in the acute phase, we're dealing most with the treatment and the side effects of treatment. And for those of you who have gone through chemotherapy know that there are many different side effects from treatment. And so during that acute phase, that's kind of what we're focusing on. Extended phase, we're dealing with fear of recurrence, recovery from some of those side effects. And I would say that during this period, fear of recurrence is probably one of the biggest things that we focus on. And then the permanent long-term phase, this is when we try to get back into our normal life, or what used to be normal, getting back into employment, relationship, self-image, and some of the long-term side effects of cancer treatment. So when we talk about long-term side effects, most cancer treatments include one or more of the following: surgery, chemo, and radiation. You could just have one, you could have all three, or a combination of all of them. So when we talk about some of the side effects from surgery, body changes and disfigurement are a big one. For example, a breast cancer patient who has had a mastectomy and their body has changed. Melanoma patients who maybe have had a skin graft when they've had their melanoma removed. And then lymphedema is when you've had lymph nodes removed in surgery, what can happen is that lymph system doesn't drain as well, which causes swelling and pain in an arm or leg, wherever those lymph nodes were removed. And then loss of fertility, when we have younger patients who have gone through treatment and have had maybe a hysterectomy, they deal with that loss there. And with chemotherapy, we have some toxicities that have some long-term effects. Certain chemotherapy medications can affect the heart, so we do monitor some testing with the heart closely. Most medications are excreted through the kidneys and the liver, so there can be damage, and we watch our kidney and liver functions closely. We also have hematologic and neurologic system effects. And hematologic is when we're talking again about our blood cells. So chemotherapy can really affect our white blood cells, the infection fighters, and our red blood cells and our platelets, which are the clotters in our blood. And sometimes long after treatment has ended, we're still dealing with those side effects of how they've affected our blood cells. With our neurologic system, we talk about numbness and tingling. So a lot of chemotherapy medications can cause numbness and tingling in the fingers and the toes, and that can be lifelong for some patients. And then hormone changes. Again, we have medications such as a targeted therapy that focuses on hormones. For example, breast cancer patients are given an anti-estrogen medication. So that can greatly affect their hormones. And then radiation therapy. So we can have some skin changes and sensitivity and lung and heart issues. There's something called fibrosis, and it's called radiation fibrosis. And what that is it's when our tissues are not as elastic or stretchy as they used to be. So this can cause problems with the lungs. And you can imagine if your lungs aren't able to stretch, makes it difficult to breathe. And then again with radiation, loss of fertility. If you've had any radiation to the ovaries or testicles, that can damage the fertility. And then another long-term effect is secondary cancers or recurrence. And a secondary cancer can be a new cancer, or it may be a cancer that has spread from other parts of the body. Certain treatments with chemotherapy and radiation can damage our bone marrow cells, and those are like our blood cells. And this can increase the risk of a later development of leukemia or myelodysplasia, which is a blood cancer. And this is why we so strongly recommend you come to your follow-up appointments, because we closely monitor these things and watch for any secondary cancers. How do we help survivors heal after their treatment has ended? We need to focus on meeting the needs of all cancer survivors to improve their quality of life. According to a report from the American Cancer Society, approximately 1 in 4 cancer survivors report a decreased quality of life due to physical problems and 1 in 10 due to emotional problems. That's a large number of people that are suffering after or feel that they don't have a good quality of life. This little box in the middle is quality of life, and there are 4 domains that need to be met to make sure that survivors have a good quality of life. One of them is physical, one is psychological, social, and spiritual well-being. So the physical well-being is one of those domains that where the survivor's needs need to be met. And in the physical well-being, this is where we talk about pain and fatigue and the ability to perform activities of daily life. So when you're not able to get up and get out of bed because you're in so much pain, your quality of life goes down. Psychological and emotional, this refers to anxiety, depression, fear of recurrence, problems with memory and concentration. And this is something called chemo brain, and I don't know if you've heard of that or have had it, but it's a real thing. But and you can see too, with anxiety and depression, if you can't get over anxiety, if you're depressed and you can't get up and do things, that your quality of life is going to be decreased greatly. And then social needs. This is relationships with family members and friends, including intimacy and sexuality. And this is something that we don't talk about very often. It's hard for some people to talk about this aspect, but this is huge because intimacy, we all need intimacy and love. And so when a survivor has gone through cancer treatment and treatment is over, it can be a big deal to start being intimate again. And it's important for partners to realize that as well. But again, that's something we don't address as much as we should. And then spiritual well-being, and this is important, either through religion and maintaining hope and resilience when we're dealing with where's my future going, will there be recurrence, how are you going to deal spiritually with that? And I think prayer is very important. So this is some of the statements that I have taken from cancer survivors that I have met with. And after treatment, I think the biggest thing that I've heard is, I worry about every lump, and I worry with every ache and pain that the cancer is back. The days leading to my follow-up appointments cause great anxiety. Everyone expects me to be back to normal, but I don't know if I'll ever be. And I feel afraid to be on my own now that treatment is done. So when we hear someone say on my own, what they're saying is they've been with us, they've been coming to the infusion center, they're getting their chemotherapy, they feel like they have all this support, and then chemo ends and now go off on your own. And they're kind of scared to do that, and that's understandable. Another one is, I'll tell a story about a patient that I had when I worked in Hibbing. She was a young breast cancer survivor, and probably a week or 2 before her appointment, she would lose her mind. She couldn't take care of her kids, she could not talk. I mean, it was awful. And it was because of being so afraid of coming and seeing what her scans would show or what her lab work would show. And she'd put on a good face at work, but she'd come home and cry every night for 2 weeks. And when she finally told me that, I made it a little easier, and I called her the minute her labs came back or her scans were back. And not everybody has these feelings, but it's important for us as providers to make sure we know which patients may need that and which don't. So this is something that patients or survivors have told me that they hear after. Treatment is over, now you can get back to your normal life. Or, you're lucky it was caught early. You're cured, you should be happy. You need to be more positive. And these are family members and friends trying to be supportive. But as you can see, I mean, I've looked at that and said, geez, I wonder if I've ever said that to someone. But as you can see, we may think this is a nice thing or not so bad. But when you're a patient or a survivor and you're looking at this or hearing this, nobody feels lucky when they were first diagnosed with cancer. What survivors often feel. Mixed feelings when they finish treatment. Again, like I said, they have an access to a team of healthcare professionals, and suddenly that decreases once treatment is over. The fear of recurrence, fear of not getting back into normal life. And then there's some feelings that often come up that were put on hold during treatment. So survivors put on a brave face and go through their treatment, and now it's over, and now they have new feelings coming out, and they need to be able to express those feelings. So how can we regain and improve our health after a cancer treatment or diagnosis? Physical activity is huge. And I know often after treatment you're tired, you have fatigue, you don't feel like moving, but physical activity is so important for physical health and our emotional and mental health. Making sure we have proper nutrition and a healthy body weight. Obviously smoking, stop smoking if you do. Decreasing our stress, and the biggest one here is follow up with regular screenings and exams. There are many patients who do not come back for follow-up or don't show up, and that's scary. And I understand that it's also scary to maybe come and what's going to happen when I go to the doctor, what am I going to hear next? But this is the best way to make sure that we don't have anything else coming up. I'm going to talk a little bit about caregivers now. This is also something that we don't put enough emphasis on, because caregiving is a wonderful experience, but it can also be difficult. So a cancer caregiver is a person who most often helps the person with cancer and is not paid to do so. In most cases, this is a spouse, a partner, or a family member. So some of the common tasks of a caregiver: assisting with activities of daily life, transportation, meal preparation, manage finances. And this might not look like a big deal, but for somebody who has never had to deal with finances in a relationship, it's a big deal. Transportation. When we talk about people going through radiation therapy, you may be driving from Grand Rapids to Hibbing every day for 5 days. And if that spouse or friend or family member works, it's very difficult to try to coordinate that. Meal preparation. People who have gone through treatment know that things that used to taste good to you often don't taste good to you anymore. So your husband or wife tries to make you a nice meal and you don't like it. So some of the common feelings that I've talked to caregivers, and they feel satisfaction. It's very enriching to be able to take care of someone that they love. Accomplishment. They found inner strength that they didn't know they had. And joy, just being able to provide love and care. There may be times of great joy and satisfaction, and there's also times of distress. And there are times when you think you're doing really well, and there's times when you feel like you can't do this anymore. And all those feelings are normal. And it's important to find help so it doesn't lead to the caregiver stress and burnout. So what this is, caregiver stress is when you do not have enough time to do all that is required or asked of you. Burnout is when that stress accumulates and you are now in a state of distress. So common signs are ignoring your own health, not eating, losing contact with your friends, social isolation, outbursts of anger, feeling resentful, anxious, and fatigue. And this can happen because of role changes. And like I said before, say you didn't take care of the bills or the finances, or you weren't the one that made the meals in the home, and now suddenly this has changed, and that can cause great anxiety. Talked about the financial pressure. Maybe both of you worked, and now the cancer survivor, cancer patient can't work, and there's one income coming in. So that can be a great source of stress. And isolation. So you don't feel like you're able to go out and socialize because you're taking care of your loved one, and that can cause stress. And I think the biggest one is guilt. Feeling as though you're not doing enough because you feel sad looking at this patient or this loved one of yours, and they're suffering, and you feel like you can't do enough to help them, and that guilt builds up. So this is a big one. How can you reduce that? Ask for help and accept it. I know it's difficult to ask for help, but when people say they want to help, they genuinely want to help. So accept that help from friends and family. Make sure you're getting exercise and your diet is healthy. And again, prayer, meditation, I think prayer is huge. Seeking professional help. If you feel like you've gotten to the point that you can't go on, you need to seek professional help. Support groups, which I'll touch on a little bit later. We are starting a new support group for caregivers. And so this is our new cancer center and infusion center at Grand Itasca. We have 6 private and 6 semi-private rooms. We have a dedicated pharmacy. So all of our chemotherapy is mixed right in our infusion center here. And I will tell you, I have had the privilege to go to many cancer centers down in the cities, university, bunch of different cancer centers when we were looking at building in Hibbing. And I will say that this is top of the line what we have here in this community. Unbelievable. So the Survivorship Program is something new that we are planning to start at Grand Itasca, and we're just working on building that program now. And what that will be is us trying to help survivors get back into their normal life or their new normal. And so patients will get a care plan. And in that care plan, they will have all the medications that they've had, the chemotherapies, the radiation treatments, what to expect for follow-up, phone numbers, and resources. So that will be coming. We're working on that now. And then our cancer support groups. So we're starting this the first Monday of the month, starting in June at 6 p.m., right in our Cancer and Infusion Center. And the first Monday of the month will be open to cancer patients, cancer survivors. And we're not excluding any type. All types of cancers are welcome. It's very informal. I'm hoping to have guest speakers. We'll have a new topic every week, and I'll be leading them. And then the fourth Monday of the month, we will have a caregiver support group. And so I've done the cancer support groups before. Caregiver will be new to me, but I think this is really important. And someone had asked, why don't you do them together? And I'll explain why. Would you want to come to a cancer support group with your caregiver and tell them how you're feeling? No. So that's why we're dividing them up. I wouldn't want to do that myself. So yep. So that'll be starting the first Monday of the month in June. And that's it on survivorship. Okay. You're welcome.